Hi, friends. Gene Valentino. Welcome back to another episode of Gene Valentino's Grassroots Truthcast. Here at the Grassroots Truthcast, we're here in the offices of Dr. Ruben Timmons in Pensacola, Florida. Dr. Timmons comes to me through my wife, in fact, who had a targeted response that was necessary in her shoulder and her neck that required stem cell treatment. Yes, that's right. That's what we're going to talk about today is the science and technology, the application, administration of stem cells in the human body right after this.
Hi, everybody. I'm Bianca Della Garza, and you have to check out Gene Valentino's Grassroots Truthcast podcast. I was a guest. He has the best guests always. Check him out.
Relationships matter because people buy people, and that's why I buy Eddie Zarin Insurance of the Zarin Insurance Agency in Pensacola, Florida. A family-owned business with over 50 years in the business, and they treat people the right way. From homeowners insurance to contractors insurance, condo insurance, commercial insurance, all the different coverages that are out there, and of course auto insurance, they've got you covered. They worry about you first. You're more than a policy number. You're a person who they're watching out for, not when the sun is shining, but after the hurricane has left. If you want real service with real savings, contact Eddie Zarin at the Eddie Zarin Insurance Agency. www.zarininsurance.com. Give them a call today. You'll be glad you did when you do. Hi, friends. Welcome back, and I'd like you to meet my guest today, Dr. Ruben Timmons, Pensacola, Florida. Thank you for joining me.
Thank you for coming.
This is very interesting, Doctor. You've come. I want a little bit about your background first. We have so much to talk about. This whole concept of stem cell therapy and research related thereto, to me, is so interesting. I'm in my early 70s, and I think the science and technology of the future has transformed the way we think about aging and living. And you bring to the table a solution. It's been around, and I've heard a lot of people talk about it. Specifically, can you describe what's unique about you and here what you're doing in the Panhandle of Florida related to stem cell research and therapy?
Yes, my interest began with research in the country of Panama. I was the head of science, technology, and innovation for that country. And when we initially started, I recognized a group that was doing stem cell infusions and injections, and that greatly interests me. So what I did to bring the standard up to what we would expect here in the United States is establish an internal review board to approve the subjects that were going to be tested or that were going to receive these injections or infusions. And then that would allow the entity to submit their findings and their data to clinicaltrials.gov.
Here in the States? Or?
Here in the States. They were in Panama, but to at least have the data at a high level where it could be viewed and valued by any other physician or any other practitioner. The concept was with this, we would demonstrate what's called a phase 1 or trial, a safety trial, showing that it would be safe and showing that the outcomes were very beneficial. So that's what got me interested.
Well, talk to me about your background just a bit as it relates to where you're working now, and then dovetail into what do people think, stereotypically think about stem cell therapy as opposed to what you're doing now, which makes it more unique?
Yeah, initially here in the U.S., there was the FDA set a standard, a rule that under a 361 guidance, meaning even though it wasn't FDA approved, you could still utilize birth tissue if it wasn't manipulated and used for homologous use. So what I did was started some studies, a retro study review that demonstrated persons with, for example, knee osteoarthritis, which was in its terminal stage, how they would respond to placenta membrane. And the outcomes were outstanding, and it again demonstrated safety, and it was published on 2 different trials or in 2 different studies. So this really began the interest, and now in 2018, there was a law that was signed into effect that allows right to try as long as these conditions were chronic and they had failed all other interventions, and people didn't have to live with this condition or chronic pain for the rest of their lives.
This is juxto the approaches that most physicians in the States have been using to handle pain management. In this case, this becomes a new avenue or a new solution.
Yes, what happens is that under the traditional manner, people take nonsteroidal anti-inflammatories, maybe some steroids, maybe some opioids, and finally surgery, all of which doesn't necessarily remedy the pain. And it really does not look on the tools why we are degenerating and the tools that are needed to make a condition that is debilitating more healthy. And this is precisely what birth tissue, stem cells, and some of the other procedures, or what's called autologous use of PRP, A2M, for example.
Okay, watch out.
Okay.
There go those acronyms again.
Okay.
PRP, A2M is?
Plasma-rich protein, alpha to macroglobulin, bone marrow, and fat.
The cells of the person's own body.
Yes, as opposed to cells from
a
placenta or birth tissue.
And the difference, to me, it's a difference without distinction. But from your point of view, what is the difference in the cell of a placenta, amniotic fluid, the umbilical cord, distinguished from you taking cells out of my body and then putting them back in my body?
It's pretty simple in the fact that if I use your cells, they're 70 years old, and they've been exposed to everything that's happened to you in life that has caused oxidative stress that has, and plus, as we age, the amount of stem cells produced are much, much less. In a birth tissue, the regenerative ability is 200-fold what we would do with our own cells in certain cases. But as we age, that ability decreases, so the amount of actually stem cells that would be harvested from your body in bone marrow, fat, blood, or otherwise would be much less and less effective.
Can you measure or distinguish the success of your own tissue versus birth tissue?
I think a lot depends on a person's age. Younger persons, athletic persons, respond pretty well to autologous use, meaning from their plasma or from their fat or bone marrow. And older persons or persons that have been exposed more to oxidative stress, poor diet, respond better to the birth tissues.
You're originally from the country of Panama, and you were a consultant physician down there with the government and the legislature you had, correct me if I'm wrong, provided protocols, proposed protocols for a process of bringing stem cell technology and the solution to the forefront through the government process. How did that happen? How did that work out?
A lot of pushback initially. It wasn't really easy, but I think the key was establishing an internal review board that could be the guardian of the subject that was going to undergo the intervention or the application of stem cells. And then as long as data was produced and kept that would show the outcome as being scientifically generated, as opposed to just hearsay or testimonials. Testimonials are fine, but it's really the data accumulation that's the most important. So this was the way that it was brought to the forefront, and with actually successful trials.
We are in an era under the Trump administration where Robert F. Kennedy Jr. and his involvement with the Department of Health and Human Services has done some transformative things overnight in many areas, diet being one of them. But has his administration been helpful in opening the door for more practical progress in the future of stem cell research?
In the way that with diet, we're subject to poor diets just because it's in our culture with processed foods, et cetera.
Which he had a significant input in changing recently.
I think it's one of the ways that we can care for ourselves, and one of the ways that we can help stave off the degenerative process.
Is that an American issue? Is it this bad elsewhere?
It's bad in a lot of places, yes.
Around the world?
Yeah, around the world, Latin America included.
Yeah, we get a bad rap for having poor standards in certain ways. We're innovative and advanced in so many ways, but we also are accused of being abusive to our bodies in the way we comment.
No, I mean, it's true. I mean, it's not, there's not one magic wand that's going to make somebody better. You have to really commit yourself to, there's no shortcut, to exercise, to meditation, and to good diet. And as long as we're able to balance that, then we can diminish oxidative stress and things that break down tissues. And for example, even diabetes, we have a tremendous amount of persons with type 2 diabetes, which is very detrimental to the immune system and tends to make things worse, along with other things. Overweight is responsible for a lot of the joint pains, hips, backs, knees, ankles, because and losing weight is a process. And even with surgery, they ask you to, the success of a hip replacement, for example, if you have to get there, is lowering your weight instead of being obese or morbidly obese, which you wouldn't be the best candidate for. Yeah. So we have to take some responsibility in what we do. And this, I think the advent of cellular treatments opens a window of time that we can recalibrate or reboot ourselves, in that we can now adjust our diet, we can lose weight, we can start to exercise, because we're going to have the energy and the state of being pain-free or diminished pain, so that you can do the things necessary to improve your overall health.
It seems your approach, correct me if I'm wrong, is more toward the real solution of cellular regeneration that fixes the problem wherever it is in the body, which alleviates the pain, presumably, as opposed to the operative procedure of cutting, excising, or shunting pain that's in the body now. Stem cells distinguishes itself because you're trying to let the body use its natural function to cure itself.
To heal itself.
Yeah.
Yes. I mean,
how's your success on that? Would you have any on the back of the envelope numbers that you can throw out about what the success is like in this new arena?
It's hard to say. I mean, it would be, there's a lot of data out there, and depends on the patient. If one is really deconditioned or obese or have a lot of underlying other diseases, then the outcomes aren't as good. In someone that's relatively healthy, the outcomes are very significant in that they can avoid surgery altogether and again, get back to their normal activities.
I wouldn't have believed it if I didn't see it, but you worked on my wife. She gave me permission to tell this story. You worked on my wife's knee, I believe it was, and injected stem cell therapy into the knee joint, something between, where was it, under the kneecap somewhere. And she had been in pain, limping for a long period of time. She got off your table and was hopping around. I actually got worried that she might have hurt herself. She felt no pain. She had tears in her eyes. I didn't know if you did something good or something bad. No offense, but I don't get too many patients jumping off a table, hopping around. So it was a concern. And she was joyful for what you had done to her. Mm-hmm. And that's why we're here. One of the reasons we're here today is that there's something you're doing here that needs to get out. And the more I researched this, the more I realized you're competing by differentiating in a world of regulation, in a world of administrative oversight and preference that has to be given towards drugs or procedures, where at times the patient's safety and concern isn't first, even though that's the mantra. They're saying it is, but it's not. There's things going on in your world that are not necessarily formidable or in the best interest of the patient initially. I noticed that isn't true here. Here, you're doing everything possible to make sure the patient is well when they leave here. Mm-hmm. How did you have the same sort of success with other patients the way I witnessed with my wife?
Yes, and this was elucidated in my publications where I used amniotic membrane as the orthobiologic, and with that, for knees, the outcomes were outstanding, and these were measured as far as function, something objectified with using using pain and function, and these patients improved in their function. They were able to transition off their non-steroidal anti-inflammatories, and in most cases off their opiates, because that's been the usual pattern that we've used for years in this country is anti-inflammatory, maybe opiate, maybe some steroids, but steroids just block the processes, whereas cellular treatments, birth tissue, and actually interferes and stops the process of degeneration. And these are the proteases, the enzymes that tear down cartilage after a while. On the other hand, steroids do work, but it's been demonstrated that continuous use of these steroids actually does more harm than good if used over longer periods of time.
I had taken a steroid at one point. Is this a degeneration of tissue? Is that what's going on?
Well, it's
with the steroid.
No, with the steroid, it's not necessarily the degeneration of tissue. It will help you because it's a potent anti-inflammatory that that blocks the process. Um, but as repeated use would cause further damage to the tissue and to the cartilage.
So what are you researching now? I know there's the application administration of material, stem cell material for the patient, but is there a research approach you're taking now to uncover some new pathway?
There are some research that we're doing, and right now I'm working with a company that looking at rheumatoid arthritis.
Rheumatoid arthritis.
And I believe it's a phase 2 where we're starting to get some really good results. And part of this is now with this, you can utilize IV infusions as well as targeted injections into the specific area of pain, like whether it be the back, the wrist, anything that rheumatoid arthritis may affect, because the effect that these cells or this tissue has on the process of inflammation. With that, we hope to have more data to justify the use in other types of illnesses or that cause pain that have failed all other avenues of treatment and is pretty debilitating.
Is there anything in your world that you're working on, either as a procedure or a product, that's considered patentable right now? Are you securing a technique that might be unique, or
I don't think so.
it's pretty standard?
It's standard in that those of us who do these applications, it has to be targeted. In other words, in order to do something in the spine, you have to do it under fluoroscopic guidance. You have to see where you're placing this medication. If it's in any of the joints, it has to be done under ultrasound. To me, that's a standard of care. To do it blindly is really not doing the full service to a patient.
That is one of the issues that was always something of concern to me that I've heard about from other people who've seen other doctors as well, and that is they are going in blind with the injection, as opposed to what you're doing. You're actually looking in there through ultrasound or whatever, and making sure that the injection of the stem cell material is precisely placed at the point of pain. I know the way you handled the rotator cuff for my wife, and the shoulder area was obviously targeted, just as the knee was. But it's very interesting. You know, Dr. Paine reveals itself to everybody differently, and we all had pains in all parts of our body. Is there any focus you have, or what do you tell people with pains in different parts of their body that we haven't talked about? I mentioned the knee, I mentioned the shoulder, but the vertebrae and the neck?
The spine, any articulation, any joint that is inflamed, or whether it be in the spine, whether it be in the shoulder, elbow, hand, knee, foot, or hip, and anywhere from damaged tendons to joint involvement itself. These are all, and again, I'll emphasize, persons that have found no other means, and maybe in some of these cases surgery wouldn't help, and they're told you have to live with this, and that's not necessarily true.
Worked on any professional athletes?
Yes.
Yeah. Joints and tendons and...
Yes.
You know, I think there's different approaches for care, and I guess one person may come in and think they're well, but it may be a recurring number of visits required. Is it a one-shot deal? Do you have a recurring treatment plan? How does it work?
Typically, what I tell patients that if it's spine related or whatever, it's one and done instead of a multiple scenario where you have back pain, you have 2 injections in the spine, and then you visit in the office, and then you do a radio frequency ablation, which in and of itself, over time and over repeated use may cause some atrophy of some of the muscle in the back. With the orthobiologic, it's typically done in one setting. Typically, we'll get 1 to several years relief, depending on the condition, depending on the compliance by the individual. If they
No pain pills or anything. This is one and done.
Well, it's a chronic disease, and people can usually say, hey, I'm more functional. I have a little pain, but I'm not taking my pain medicines now. And so that's what we hope, because we know that a lot of these drugs that we use cause systemic problems, such as high blood pressure, kidney gut disease. So most people want to get off their medications because they do have terrible side effects, whereas the orthobiologic does not.
What's the procedure when the patient's coming in? I'm kind of curious as to what's actually happening. Is this like a foreman in a job site, the product?
Yes, in a way, it is. And what happens is that when this tissue, the orthobiologic, is placed in an inflammatory site, it's like having a construction site wherein you're getting orders, and it's about signaling other cells and other cellular products, exosomes, all these things that we get into, and with that, repair and allow your body to self-repair also. A lot of these stem cells that are injected are sequestered in the lung. So it's the proteins, it's the signaling, it's this foreman that's sending out the signals and getting all the right delivery of anti-inflammatory medications. It's you have the whole pharmacy at work.
I see.
Instead of just one particular drug or one particular part of a stem cell product.
So it's more than just a drug. It's really the transmission of messaging by the stem cell product. Absolutely. That's triggering regeneration of other cellular activity in the body.
Yes, the regeneration, if as well as a prolonged anti-inflammatory.
And amniotic fluid, placenta, and the umbilical cord materials are more triggering, are more successful than the use of aged cells within one's own body?
Correct.
Because of the signaling coming off that younger product.
Yes, and its overall potency. That it's not been exposed to, again, oxidative stress. It's a young cell.
You got a system here that seems to be working. It eliminates a lot of people taking a lot of drugs. Is that your impression of the outcome of your treatment?
Yeah, we in the publications we measured the use of drugs, anti-inflammatories, as well as decreasing from opiates, and I think every individual that comes through here want to get off these medications because it doesn't make them feel good because they have other side effects from the medications.
What are people experiencing when they leave here? They feel success?
It depends. Everybody, some persons have almost immediate relief.
Really?
and others it may take up to 12 weeks, more of a gradual onset of pain relief, of improved function. But and that's just a variability between patient.
We know what your success has been by the level of responses we've heard, but what's your appetite? What's your interest? Where would you like to see the future of stem cell research and therapy go?
I'd like to see it available for everyone.
Is it restricted in some way now?
Oh, yes. I mean, even with this law now that's been signed into existence, it's specific in that it has to be chronic pain and everything else that failed. And what we'd like to see is catching the disease early as opposed to waiting till it becomes too chronic.
Preventative medicine.
In that fashion. Yes.
What a concept. That's what the original intention of insurance and many other technologies were supposed to be providing. Not the protection of certain vendors, folks, but rather the initiation of research and development to prevent injury or sickness in the first place. Did I put words in your mouth, or is that really?
That rings the bell.
Okay.
That is that's the goal, is to treat things before they get chronic, intervene with the patient, educate the patient on the things that they have to take responsibility for in order to prevent further damage to their body.
So maybe living to 130 isn't that crazy of an idea after all. It seems that what you're doing is helping the body nourish itself and live longer. And who could ask for a better therapy? This has been very interesting, Doctor. Dr. Ruben Timmons is with us from the Panhandle of Florida, and his specialty is stem cell research and therapy. And when we return, you can give your website, your related contact information. Let's go take a tour and see what's going on right after this message. Relationships matter because people buy people, and that's why I buy Eddie Zarin Insurance of the Zarin Insurance Agency in Pensacola, Florida. A family-owned business with over 50 years in the business, and they treat people the right way. From homeowners insurance to contractors insurance, condo insurance, commercial insurance, all the different coverages that are out there, and of course auto insurance, they've got you covered. They worry about you first. You're more than a policy number. You're a person who they're watching out for, not when the sun is shining, but after the hurricane has left. If you want real service with real savings, contact Eddie Zarin at the Eddie Zarin Insurance Agency. www.zarininsurance.com. Give them a call today. You'll be glad you did when you do. So, doctor, what do we have here?
This is an ultrasound machine, and basically what it does, it allows us to look at any orthopedic joint that may be compromised or that we're thinking of injecting an orthobiologic. So the patient is usually lying down or sitting up, and we're able to visualize in live time and direct the product to that specific area.
So it's at least a two-man job here.
Yes, I have an assistant.
Yeah. This would be the standard application room for that.
Yeah, we have another room next door that we would do the same. We have two rooms that are ready to go.
I couldn't help but notice this this filing that you were involved in from the Journal of Regenerative and Biology and Medicine, going back a few years, where are we?
2020.
2020, there it is. You want to describe what this is about?
Well, we looked at 40 subjects' knees and measured their pain scales and measured their function as posed by the WAMAC, which is a functional scale. and also their ability to wean off medications. And the results were pretty outstanding in that to come off medications went from something like 80% down to 25%.
Through the application of stem cell.
After the application. And their functional skills, as proposed by the WOMAC measurements, improved very significantly, as well as their overall pain skills.
I'm so interested in hearing more, too, in the minutes ahead about the transition that's occurred in legislation and throughout the country about making things easier for not only the application of stem cell therapy, but other related therapies that are associated with it. But this is a kind of room that there'd be at least two of you, right? There'd be the room of, there'd be the someone wanting the ultrasound, and then you're applying the stem cells.
Correct.
Interesting. Let's go see the main room you do a lot of your work in. Wow, I didn't realize you had all this equipment here, doctor. How is this different than the other room?
This is where we do procedures, application of orthobiologics, usually on the spine, sometimes with the hip, sometimes with the shoulder, but mostly spine. And this allows us to pinpoint and precisely where the lesion or the problem is, whether it be in the spine, the joints, around the nerve tissue. We're able to visualize this in lifetime. With this, we're 100% sure that we've placed the orthobiologic in the correct space. This enhances a person's ability to then get better and hopefully become more and more functional.
Back in 2018, the United States government, under President Trump and the federal legislation came forward, modifying the way healthcare is delivered in the States, making it easier for you here now, right?
Well, here in Texas, because they've recognized that this is a new avenue for persons to take, and that the orthobiologic, whether it be stem cells or birth tissue, has a huge impact on healing and function.
Well, very interesting. Hey, let's go out front and see how people could get hold of you. Great being with you today, Doctor. Before we finish, what should people be looking for? What are the things they should look for or be worried about before considering stem cell therapy?
About three things that are very important. One, that the tissue bank where the tissue is acquired is FDA registered, and at the same time meets criteria of a 361 designation, minimally manipulated, and
that's what 361 means?
Yeah, and used homologously. And third, that the provider has a very in-depth consent form, so the patients know, and by having these regulations placed on the registered tissue bank, you can be more assured that what the product you're receiving is safe.
And folks, you're going to see that on the website, which is at the bottom of the screen, and the phone number. So look for it there, and you can browse around on Dr. Timmons' site. And when people do contact you, what's the procedure they go through for qualifying?
Usually we will send them a form to fill out, outlining all their medical issues, and we will review that to determine whether or not they are a good candidate. And this involves their medical history, any diagnostic tests that have been done. So we have all the information at hand when they show up for an appointment.
There's a lot of people out there claiming they're involved in stem cell therapy, but they're not renegades or cowboys, but they're certainly not following protocols that obviously I've seen you display today. What's the difference? What should the consumer be looking for in terms of that kind of care?
They need to ask those three questions that I just
stated.
answered. Whether the tissue bank is FDA registered and whether they're using the tissue or the biologic as outlined being minimally manipulated.
And that all happened back in legislative change in 2018. I think it was under the Trump administration where things became more procedural and more, the gateway opened for more research, development, and administration.
That's correct.
Doctor, I can't thank you enough for joining me today on the Grassroots Truthcast. This has been a pleasure. We've covered a lot of ground, and I really hope you, the audience, get on his website or call him directly to book an appointment. And between you and the doctor, determine for yourself the applicability of stem cells therapy for your care. Thank you again.
You're very
Appreciate your
welcome.
time.
Thank you.
And to you, I thank you for joining us on another episode of the Grassroots Truthcasts. See you soon. Relationships matter because people buy people, and that's why I buy Eddie Zarin Insurance of the Zarin Insurance Agency in Pensacola, Florida. A family-owned business with over 50 years in the business, and they treat people the right way. From homeowners insurance to contractors insurance, condo insurance, commercial insurance, all the different coverages that are out there, and of course auto insurance, they've got you covered. They worry about you first. You're more than a policy number. You're a person who they're watching out for, not when the sun is shining, but after the hurricane has left. If you want real service with real savings, contact Eddie Zarin at the Eddie Zarin Insurance Agency. www.zarininsurance.com. Give them a call today. You'll be glad you did when you do.